Do you think you are too young for a heart attack? Think again. Recent data reveals that heart attacks among people under 40 have more than doubled over the past decade. And what is even more alarming is that when young people have heart attacks, they are more likely to die from them. Today, I will explain why this is happening and what you can actually do to protect yourself. Welcome back to I'm Dr. Vivian Hart. Let me start with a story that should not be true. A 32-year-old software engineer went to the emergency room complaining of severe indigestion. He had no family history of heart disease. He was not overweight. He exercised twice a week. The doctors almost sent him home. But a junior resident ordered an EKG just in case. It turned out he was having a massive heart attack. Stories like this are no longer rare. According to a 2025 review published in the Journal of Cardiovascular Development and Disease, evidence shows a rising incidence of premature coronary artery disease and heart attacks in patients under 50 years old. This increase is linked to the growing prevalence of traditional risk factors among younger people, including type 2 diabetes, high blood pressure, obesity, and high cholesterol. But that is only part of the story. Emerging research points to less traditional factors that are accelerating this crisis. So what is driving this surge? According to a 2026 report from Harvard Medical School, there is growing concern about a worsening problem among younger adults. The report shows a sharp rise in hospital death rates from severe first heart attacks among those aged 18 to 54. Most of the deaths were men, but women died at higher rates. The lead author of the report said that the story of young adults was stark and compelling. He noted that we are seeing cardiovascular risk factors and diseases show up earlier in life, which changes the entire arc of health for individuals and increases the likelihood of decades of chronic illness. Now let us talk about the 3 hidden drivers that may be affecting you or someone you know. The first hidden driver is chronic stress and sleep deprivation. When you are chronically stressed, your body releases a hormone called cortisol. Cortisol is designed to help you handle short-term emergencies. But when stress becomes chronic, your cortisol levels remain elevated. This damages the endothelial lining of your blood vessels. Think of your blood vessels as a smooth highway. Cortisol damages the surface, creating rough patches where cholesterol and inflammatory cells can stick. Over time, this leads to plaque buildup. A 2025 review published by researchers at Emory University found a possible link between psychological distress and inflammatory markers in younger patients with a history of heart attack. The study examined 3 specific markers of inflammation that have previously shown a significant association with atherosclerosis. What is more concerning is that the prevalence of mental health disorders in the U.S. is growing steadily, and younger patients are a particularly vulnerable group because they have higher rates of mental health disorders compared to older adults. Sleep deprivation makes this worse. A cardiologist writing in a 2025 medical column explained that many young professionals sacrifice sleep in pursuit of productivity. But poor sleep increases stress hormone levels, impairs glucose metabolism, and produces oxidative stress that damages the arteries. He recommends at least 7 hours of quality sleep per night, calling it not a luxury, but a medical necessity. Let me dig deeper into the biology of stress. When you experience a stressful event, your sympathetic nervous system activates. This is your fight-or-flight response. Your heart rate increases, your blood pressure rises, and your blood vessels constrict. This response is meant to be temporary. But in modern life, many people experience chronic, low-grade stress from work, finances, or relationships. This keeps the sympathetic nervous system activated for weeks or months. Over time, this persistent activation leads to high blood pressure, increased heart rate variability abnormalities, and direct damage to the artery walls. A 2024 study in the Journal of the American College of Cardiology found that young adults with high chronic stress scores had a 27% higher risk of developing coronary artery calcification over a 5-year period, even after adjusting for traditional risk factors. The second hidden driver is substance use. And I am not just talking about obvious drugs like cocaine or methamphetamine. A 2025 comprehensive review published in the journal Addiction and Health examined cardiovascular complications related to multiple substance groups, including opioids, stimulants, nicotine, caffeine, alcohol, cannabinoids, tranquilizers, and anabolic steroids. The review found that substance use disorders affect many young people, and the complications include a range of acute and chronic cardiovascular diseases. A 2021 study published in the journal Heart, which analyzed data from over 135,000 individuals with premature heart disease, found striking associations. Recreational drinking, smoking, and drug use were linked to 1.5 to 3 times higher odds of heart disease. The associations were even stronger among women. Tobacco smokers were nearly twice as likely to have premature heart disease. Recreational drinkers were 50% more likely. Cocaine users were almost 2.5 times as likely. Amphetamine users were nearly 3 times as likely. Cannabis users were more than 2.5 times as likely. And those who regularly used 4 or more substances were 9 times as likely to be affected. Even energy drinks deserve attention. Many young adults consume multiple energy drinks daily without realizing the cardiovascular strain. High doses of caffeine combined with other stimulants can increase heart rate, raise blood pressure, and in susceptible individuals, trigger arrhythmias. A 2025 case series in the Journal of Clinical Medicine reported several instances of young adults experiencing atrial fibrillation after consuming more than 500 milligrams of caffeine from energy drinks within a few hours. These arrhythmias often resolve with cessation, but they can be a warning sign of underlying electrical instability. Vaping is another concern. E-cigarettes deliver nicotine and other chemicals that promote oxidative stress and endothelial dysfunction. A 2024 study found that young adults who vaped daily had significantly lower flow-mediated dilation, a measure of artery health compared to non-users. The effect was similar to that seen in traditional smokers. The third hidden driver is a poor diet combined with a sedentary lifestyle. A 2025 review in the Journal of Cardiovascular Development and Disease highlighted that the increase in premature heart attacks is linked to the growing prevalence of traditional risk factors among younger people. Type 2 diabetes, high blood pressure, obesity, and high cholesterol are no longer conditions of old age. They are increasingly diagnosed in people in their 20s and 30s. A 2026 study published in the Journal of the American Heart Association examined nearly 1 million hospitalizations for heart attacks in people aged 18 to 54. The researchers analyzed more than a dozen risk factors and found that 3 non-traditional factors particularly stood out in young people: chronic kidney disease, non-tobacco drug use, and lower income. But traditional risk factors like high blood pressure and high cholesterol remain key drivers. The study's lead author noted that while these factors are important in older adults, they clearly have an impact in young adults as well. A cardiologist writing about the growing crisis explained that the answer lies primarily in modern lifestyle choices, including poor diet, physical inactivity, chronic stress, and inadequate sleep. These are not just bad habits anymore. They are root causes of inflammation, oxidative damage, and early plaque formation in coronary arteries. He specifically pointed to 3 dietary dangers. Refined sugar is not just empty calories, it is a potent inflammatory agent that damages the endothelial lining of arteries. Industrial seed oils high in omega-6 fatty acids are unstable and prone to oxidation when heated, generating free radicals that damage blood vessels. And ultra-processed foods, which almost always contain refined sugar or seed oils or both, are engineered to be hyperpalatable but toxic to the cardiovascular system when consumed regularly. Let me expand on the science of atherosclerosis. Atherosclerosis is the buildup of fatty plaques inside arteries. It begins with injury to the endothelium, the inner lining of the artery. This injury can be caused by high blood pressure, high cholesterol, smoking, or inflammatory molecules. Once injured, the endothelium becomes sticky. Low-density lipoprotein particles, often called bad cholesterol, enter the artery wall. There, they become oxidized. Immune cells called macrophages engulf these oxidized particles and become foam cells. These foam cells accumulate, forming fatty streaks. Over time, the streak grows into a plaque. The plaque may narrow the artery, or it may rupture. When it ruptures, a blood clot forms, blocking blood flow to the heart muscle. That is a heart attack. In young people, the process is accelerated because multiple risk factors act simultaneously. For example, a young adult who vapes, drinks energy drinks, eats a high-sugar diet, and sleeps poorly may have the arterial age of someone 2 decades older. Physical inactivity compounds these risks. A sedentary lifestyle leads to insulin resistance, poor circulation, and increased visceral fat, even in people who are not visibly overweight. The same cardiologist recommends at least 40 minutes of physical activity at least 5 days a week. He notes that walking is the simplest and most powerful habit to protect your heart. But there is more. High-intensity interval training, or HIIT, has been shown in a 2025 meta-analysis to improve cardiorespiratory fitness and reduce blood pressure more effectively than moderate continuous exercise in young adults. Even small amounts of movement throughout the day matter. Breaking up prolonged sitting with 2-minute walking breaks every hour can improve vascular function. Now that you understand what is driving this crisis, let me give you 3 actionable steps to protect your heart. Step 1. Prioritize sleep and stress management. Aim for 7 to 8 hours of quality sleep per night. Create a consistent bedtime routine. Limit screen time before bed. For stress, incorporate daily practices like deep breathing, meditation, or simply taking short breaks throughout your day. Even 5 minutes of focused breathing can lower cortisol levels. A 2025 randomized controlled trial found that participants who practiced mindfulness meditation for 15 minutes daily for 8 weeks had significant reductions in blood pressure and inflammatory markers compared to a control group. You do not need to become a monk. Just a few minutes of paying attention to your breath can shift your nervous system from sympathetic to parasympathetic dominance. Step 2. Eliminate or drastically reduce recreational substances. This includes tobacco, vaping, recreational alcohol, cannabis, and any illicit drugs. If you use energy drinks, limit them to occasional use and avoid combining them with alcohol. If you are a polysubstance user, meaning you use multiple substances, your risk is significantly higher. Seek support if needed. Many communities offer free or low-cost counseling for substance use. The first step is recognizing that even occasional use carries risk. For alcohol, the evidence suggests that any amount of regular drinking increases cardiovascular risk in young adults. A 2024 study found that young adults who drank 10 or more drinks per week had a 25% higher risk of hypertension compared to non-drinkers. For cannabis, the association with heart attack is strongest when it is smoked. Edibles may carry less respiratory risk but still affect heart rate and blood pressure. Step 3. Rebuild your diet and movement habits. Reduce refined sugar, ultra-processed foods, and unhealthy oils. Increase whole foods like vegetables, fruits, lean proteins, and healthy fats like olive oil or coconut oil. And move your body. You do not need a gym membership. Walking for 40 minutes, 5 days a week, is enough to meaningfully reduce your cardiovascular risk. But consider adding strength training twice a week. Muscle mass is metabolically active and improves insulin sensitivity. A 2025 study found that young adults with low muscle mass had a 40% higher risk of developing metabolic syndrome over 5 years. Simple bodyweight exercises like squats, push-ups, and lunges require no equipment and can be done at home. Let me give you a practical eating framework. Instead of focusing on what to avoid, focus on what to add. Aim for at least 5 servings of colorful vegetables per day. These provide fiber, antioxidants, and potassium, all of which support heart health. Replace sugary drinks with water, unsweetened tea, or sparkling water with a squeeze of lemon. When you eat grains, choose whole grains like oats, brown rice, or quinoa. For protein, include fish twice a week, especially fatty fish like salmon or sardines, which provide omega-3 fatty acids associated with lower inflammation. A 2024 systematic review found that young adults who followed a Mediterranean-style diet had lower carotid artery thickness and better endothelial function compared to those on a typical Western diet. Now let me be clear about when you should see a doctor. If you have any risk factors discussed today, including a family history of early heart disease, high blood pressure, diabetes, high cholesterol, or a history of substance use, you should have a conversation with your healthcare provider. Do not assume you are too young for a cardiovascular assessment. A simple checkup that includes blood pressure measurement, fasting lipid panel, and blood glucose can identify problems early. Some doctors may also consider coronary artery calcium scoring in young adults with multiple risk factors, though this is not routine. The key is to be proactive. Do not wait for symptoms. I also want you to know the warning signs of a heart attack, because they can look different in younger people and in women. Chest pain or discomfort is the most common symptom, but it is not the only one. Shortness of breath, unusual fatigue, indigestion or nausea, and pain in the jaw, neck, or arm can also be signs. If you experience any of these, seek medical attention immediately. Do not dismiss them as stress or a pulled muscle. A 2025 study of young adults who survived heart attacks found that nearly half had ignored symptoms for more than 2 hours before seeking care. Common reasons for delay included assuming it was heartburn, anxiety, or a muscle strain. This delay can be fatal. Time is muscle. The sooner blood flow is restored, the less heart muscle is permanently damaged. There is good news. The heart is resilient. When you adopt healthier habits, your cardiovascular system can improve surprisingly quickly. A 2024 intervention study placed young adults with multiple risk factors on an 8-week program of dietary changes, stress management, and moderate exercise. At the end of 8 weeks, participants had significant reductions in blood pressure, LDL cholesterol, and inflammatory markers. Some even showed regression of early plaque formation on follow-up imaging. Your body wants to heal. You just need to give it the right conditions. To summarize, the rise in heart attacks among 30-year-olds is real and frightening. The 3 hidden drivers are chronic stress and sleep deprivation, substance use including alcohol and energy drinks, and a poor diet combined with physical inactivity. These factors do not act in isolation. They amplify each other. A stressed young adult who sleeps poorly may reach for energy drinks to function, then alcohol to unwind, then comfort foods that spike blood sugar. Each choice builds on the last, creating a perfect storm for the cardiovascular system. The solution is not a single magic pill, it is a combination of small, consistent changes. Prioritize sleep, manage stress, eliminate recreational substances, eat whole foods, move your body daily. These are not complicated, but they require intention and effort. Start with one change, master it. Then add another. Remember, this is educational content. Always consult your healthcare provider before making significant changes to your health routine, especially if you have a known medical condition or take prescription medications. If this video opened your eyes to the real reasons young people are having heart attacks, share it with someone you care about. There is a good chance someone in your life needs to hear this information. Subscribe to Heh for more science-based health education. I post new videos every week breaking down complex health topics into simple, actionable steps. And leave a comment below. What surprised you most about the hidden drivers of heart disease in young adults? I read every single comment, and I will do my best to answer your questions. I'm Dr. Vivian Hart. Take care of your heart, and I will see you in the next video.